Hello, everybody. Welcome to this final long COVID plus conversation, or at least final for this academic year. Before we get started, I want to thank you all for joining me either online during the sessions or through watching the videos or emailing. Or presenting, of course. I'm very glad that all of us made this together, and I want to thank you for that. Today we have a round table around the topic of moving forward, about a round table about finding more just and caring ways forward in academia and also in larger society. And our first presenter is Dr. Alice Vleerackers. She's an assistant professor of journalism and civic engagement in the Department of Media Studies at the University of Amsterdam. Her research examines the intersections of journalism, health and science communication, and scholarly communication. She's a member of the Amsterdam School for Cultural Analysis and the Taal- en Cultuursectorplan program. Beyond her work at the University of Amsterdam, Alice is also a freelance writer, a researcher at the School.com Lab, vice president of the Public Communication of Science and Technology Network, and co-founder and co-chair of PCST's Diversity, Equity, Inclusion and Accessibility Committee. And today, Alice will present some of her research for and with long COVID patients. So Alice, please begin your presentation.
Thank you so much. I don't know if I've ever been introduced with an introduction that's probably as long as my presentation. So thank you. And really nice to meet everybody here. I've been following along offline mostly, but it's been really interesting to see people working in this space, which I have been doing some research in for almost a year now in collaboration with my wonderful colleagues whose names are on the screen. Kaylee Jamieson, Stacey Dawes, Esther Kaur, Kiffer Card, Anne-Marie Nicol, Rakib Tesfaye, and Kaylee Byers. These folks are mostly at Simon Fraser University in Vancouver, Canada, where this research took place. But I think some of the findings will be helpful for our conversation here today in the Netherlands, as my conversations and reading about long COVID suggest that this is not just a BC issue, the ways in which people are trying to navigate a challenging information space. Lost in the dark, searching for your own answers. That's how one of the 30 people with long COVID that we interviewed described their experience trying to find information about the condition that had completely upended their lives. Again and again, in these semi-structured interviews that we conducted with folks who were grappling with long COVID during the course of 2023, we found people offering a similar sentiment of feeling abandoned. One participant used the word invisible to the government, to official sources. And as part of hopefully a solution to help people feel less lost in the dark, to provide them some guidance and support in navigating this challenging experience, we conducted an interview study looking at the main barriers that people are facing in trying to get information, the media spaces they're finding useful, and hopefully some ways that we might be able to better support folks in that search for answers. These interviews revealed that there's this intense hunger for information. This desire to learn anything that anybody anywhere knew about long COVID. And what was interesting here is that folks we interviewed were not just looking for answers that were practical. They didn't just want to know how to get better, how long it would take to get better, although many also had this broader thirst for knowledge. They wanted to understand how this condition works, how this disease works, where it comes from. They're really interested in the science for science's sake, for knowledge's sake. And usually this quest for information started with a visit to the doctors, but we found that this visit almost always led to a dead end. We had people say things like, it was all the stuff that I already knew. They just kind of told me, hold tight, you'll be fine. Doctors didn't have the answers they needed and tended to dismiss them. In the worst cases, people were gaslit about their symptoms, told things like, well, you're overweight and depressed. You don't have long COVID. When this trusted source of information turned out to be not so useful, many explored other sources, like official government websites with long COVID information, but found that this information tended to be very generic and not super helpful to them in their very specific condition. They looked at academic research articles. This to me was fascinating because people were learning to use services like PubMed, Google Scholar, in some cases with a lot of depth. They found research very useful because it was trustworthy, because they preferred more sciencey type things as opposed to the anecdotal type stories they were hearing all around them. But they were disappointed by research because it was always so tentative. Their research was evolving just as the condition itself was evolving. And in some cases, people found research very discouraging. It made them feel scared into thinking you're never going to get over it, as one participant put it. As a journalism professor, I was excited to see that some folks explored the news as a source of information about long COVID. But many people found this was also not a useful source, primarily because they kept hearing the same sorts of stories over and over again. Like the official government websites, there was nothing new. It was all kind of generic. It wasn't personal to them. In many cases, people also felt that they weren't seeing their own experiences reflected in these stories. The people who were featured in the news were either far worse off than them, the most extreme of the extreme, because that provides drama, it provides a story, or they were doing so well, the mildest of the mild cases, as a way to diminish the impact of this condition. The most double-edged sword in this data that we found was the use of social media platforms, which many folks turned to actually as a way to get research from doctors they were following, scientists who were sharing new COVID findings, and also because they provided a sense of community. In particular, participants in our study said they often used Facebook groups that were dedicated spaces for long haulers to come together and have conversations. Maybe similar to a community like this, it helped them feel heard, so that gave them a sense of validation that they hadn't received from their doctors or in the news. But these spaces were also hella depressing, as one participant put it, because there were so many sad stories, so many others who were as bad off as them or sometimes worse off than them. And even more concerning to participants, social media were described as a cesspool of disinformation, or as another participant put it, a cesspool of nonsense. There were many people on social media who were trying to make a quick buck off of the desperation and the lack of evidence-based treatment for long COVID available to sell miracle cures, including lots and lots of supplements, as our data suggests. And finally, some patients were lucky enough to receive a referral from their doctors to a long COVID specialist, a paramedical professional like a naturopath, an occupational therapist, or to a dedicated long COVID clinic, which were set up throughout British Columbia where this research took place as a way to provide education and some support for folks with long COVID. These, sort of like many of the sources, had some value, but also some issues. Again, there's a focus on research, with people appreciating that some of these specialists and even the paramedical professionals had papers and studies that they were quoting. They were doing their own research that their doctors were not doing. But also they found that these people were affirming. They validated their condition, they validated their symptoms, and they were actually empathetic to what they were going through, providing a sense of comfort, support, and affirmation that was missing from so many of the other sources. What does this mean for us? For me, I think in terms of a positive finding, especially because many of us are scholars, is the primacy of research and expert knowledge. This was by far the most preferred source that participants named, even though it was also the scarcest and the least available. Participants were also really looking for things that were specific and relevant to them because long COVID can look so different for every person. They wanted things to be up to date. They wanted it to be credible and trustworthy. However, when preferred sources that had all these characteristics were scarce, people were willing to turn to alternatives, even when they knew and acknowledged that these alternatives were problematic, even when they had deep concerns about misinformation. But another really key point I want to highlight here is that while these information needs, the desire for knowledge really drove people's search for answers, it were emotional and relational needs for support, validation, and hope that actually made people sustain their use of these different kinds of information sources, even in cases where they knew the informational value of those sources was limited. So this emotional and relational component is so key. And it's with that where I want to end today, which is with a question I hope we can discuss during this roundtable of how we can support people with long COVID, not just intellectually, but also emotionally and socially, especially in cases like this, where we ourselves, as researchers, do not yet have all the answers. Thank you.
Thanks a lot, Alice. Maybe you want to stop sharing your screen. Yes, thanks a lot. Before we turn maybe to your question, I have one very general question about the situation in Canada. So what kind of healthcare is available for folks with long COVID there?
Yeah, so Canada has a system where healthcare is very affordable. Like just being able to go to your doctor is almost free. Like compared to here, it's much cheaper. The medical coverage that you get as a Canadian is like $35 a month. So 20 euros a month, and you can go to any doctor or hospital for that. There were these long COVID or post-COVID recovery clinics that were introduced throughout the province of British Columbia early on in the pandemic. And these were spaces that primarily there were some occupational therapists and physiotherapists and sort of paramedical professionals there, but also some doctors who were meant to be able to help a bit with more diagnostic work. Though our participants told us that the doctors were not very helpful, it was much more the educational component that these spaces were providing, which was largely through online webinars and kind of conversation groups with long COVID patients, and usually an occupational therapist or a doctor, where people could exchange experiences. They could hear what was available through the limited research and what was available through what these occupational therapists and paramedical professionals had learned from other chronic illnesses or illnesses with similar impacts like chronic fatigue or many different movement-based what's the word for that? Autoimmune conditions. So it was largely, in terms of care, these clinics were much more an educational space than really a place where people were getting treatment in most cases.
Yeah, but it's still really great that they were there. And I think that, yeah, like you say, education is also a form of validation. You know, it's also, I think that we missed that a lot in the Netherlands, especially in the beginning of the pandemic. I think it's changing a bit now, but still very slowly, and only this kind of care is only available for a very small amount of people. Is there someone who wants to ask a question or share an experience? You can also do that in Dutch, and I will translate it.
Ik kan ook Nederlands praten. Dus.
I have one other quite specific question about the sources that you mentioned, because I found when I was ill that indeed academic research was, the most useful source in a sense, and in combination with conversations with other patients. But I'm wondering about the kind of websites that are in between the official government websites and the social media, so patient-led websites like Mepedia, these kinds of um, organizations and yeah, places where you can find a lot of information. And these are mostly patient-led. So I'm wondering if, because that's a very valuable category of information, I think, because it's on the one hand written by folks with an understanding of the condition, but they are also yeah, providing all the up-to-date knowledge, or for example, the blog Health Rising, and there are some other, yeah, similar websites. I was recently, somebody pointed me to the Sick Times, which is a
Yeah.
different kind of outlet, but also very useful, I think, for patients. So, what do you think about this category of information?
Yeah, so I'm just typing notes as you say this because this is interesting. It really wasn't mentioned in any of our interviews.
Mm.
People did not mention these spaces, but the Facebook groups and Reddit was seemed to be offering a very similar kind of patient-led resource sharing. So a lot of people were using social media and Reddit specifically and as a way to share links to things or share information with citations. But it's interesting to me that people didn't mention these websites because they do seem like they might fill a gap by addressing both kinds of needs, like the informational ones and more of
Yeah.
the relational value. Because people also said that even though they found social media to be problematic from a misinformation and information credibility perspective, they found it was actually really valuable to have, as one put it, qualitative data and to actually that they put a lot of trust in some of the personal stories they heard. So these sorts of websites seem like they would be a natural fit. And so I don't know if it's a cultural, I don't know why these people weren't turning to them. Many people did, however, mention the internet in this very
Mhm.
broad way, which is a source that's wasn't on my slides. But that to me is also quite interesting that many people don't even differentiate between sources. They're
Mm.
just, I go on the internet and what pops up. Um, could be any of these websites, but it could also be really awful websites.
Mm.
We don't know, and people didn't seem to know or care for that subset of participants.
Yeah, exactly. Thank you. And I think that the internet is indeed something that you turn to. But then the good thing about these kinds of websites is that they're quite reliable in terms of interpretation of science. And that separates them, I think, from Facebook groups and these kinds of uh, places. Although when you are a member of a Facebook group with a lot of members, you can sort of do your research by, seeing how a certain medicine or supplement works for everybody. If you sort of keep track of it, so you can do very bad research. Uh,
Convenient sampling. Love it.
exactly. Yeah. Yeah, thanks a lot. Is there anybody else who wants to ask a question, or maybe we can watch Judith's video first and then discuss both? I will first share the video and then we also turn back to you, Alice. Okay. Oh, I need to enter my password.
Hello, let me introduce myself. I am Judith,
Can you hear the sound of the video? Okay, great.
and even though I see and contemplate the critique on identity politics a lot for now, I am comfortable enough to say that I'm a proud queer, mad, and crip member of Disability Justice Collective Feminist Against Ableism, the organization doorbraak.eu, and I organize around the topics of ongoing pandemic and mad studies and mad pride also. Analyzing and moving through the world through intersectional and anarchist perspectives suits me best, and I have a bachelor's degree in literary science. I was asked what my long COVID wish is for social science and society as a whole. Let me start with accessibility in relation to COVID first. Universities have stopped taking any measures against the spread of COVID, whilst the pandemic is ongoing and remains a mass disabling event. The classes are not recorded and can't be watched back after they've been given, makes that a lot of students, immunocompromised like myself and not, have to expose themselves to risk. For those of us with long COVID and who are bedbound for whatever other possible reason, that means no education anymore at all. If we'd focus less on social science as a school of thought alone, and also focus on the actual body minds that want to study at the university, and accommodate them, we'll find that the kind of questions we ask and research we do will become much more interesting and diverse, because a lot more people would be included. There are many focus points I'd like social science to pay attention to in relation to long COVID, but for the sake of the time restrictions given, I'll summarize what comes to mind as most urgent. I'd like social science to investigate the culture of denial around COVID, the ongoing pandemic, and long COVID. Studies like the one done in the US that showed that as soon as white Americans learned about COVID racial disparities, they became less afraid of the virus, and support for mitigation reduced. Where are those studies in the Netherlands? It is the most marginalized that are put at most at risk from the start of the pandemic and to this day. It impacts us all, yet it is the most exploited and marginalized for whom the consequence of a COVID infection is the most impactful and deadly. What it means for society that more and more people are disappearing from public life due to long COVID or post-COVID, and whether that's because of misinformation, coercion, or indifference. Abandonment is not an accident. I want social science to sound the alarm on long COVID. Sound the alarm by focusing on the direct link between pandemics and fascism, both historically and the fascism we face today. Sound the alarm for all of us with long COVID and post-COVID who are left without proper care, and that how COVID has been dealt with from the start is eugenics, a harmful pseudoscience that didn't start with the Nazis and certainly didn't end after the Second World War. My wish is that social science starts looking critically at how they organize education, ask critical questions, and do critical research after long COVID and long COVID's impact on society. And for social science and society as a whole, I really wish there would be collective recognition of how we're all vulnerable, how we are all being made vulnerable. And that recognition comes with changed behavior, like taking measures again and looking out for those of us who've already been made to disappear.
This video was by Judith de Hond from Feminists Against Ableism, and Feminists Against Ableism is a collective of disabled, sick, neurodivergent, and mad feminists. They push back against ableism and intersecting forms of exclusion. Their disability justice collective dreams of a world in which disabled people are leading the way to access, justice, and inclusion. And I think this came across quite clearly from this video. I think that there are a couple of points that I would also like you to ask you about, Alice, because I think that academia is very conservative in a sense. So researchers, even those who study the questions about social justice and about long COVID, for example, often stay within the sort of set paradigms. And I think that Judith asks us, very clearly to look at how we organize education, which is a very good point. And we discussed this also in relation to children, because I think that this is, of course, true for students, but it's also true for younger children and school children. And in the Netherlands, it's very hard to organize education if children are sick with long COVID. Yeah. And I think that this is a discussion that we're really not having in academic circles at the moment. How do you feel about this? Should we begin a group focused on this? And anybody else, if you want to drop in, please join us.
Yeah, I mean, I think I'm reminded when I was listening to Judith of like a few participants actually, who said that some of the isolation they were experiencing was because, in their words, like people just want to forget about COVID. We are a reminder that you can't forget about it, and people just have. So the point that Judith made about denialism and the fact that it could be useful to better understand the roots of this denialism, but also, are there ways to allow people to recognize their own vulnerability to things about COVID, and not freeze? Because I think it's very hard for us to imagine going back to a place that still exists, but we have all agreed we're going to pretend it doesn't exist. Yeah, I think people have, at least in our group of folks we spoke with, were feeling this very strongly, and that I think creates a big barrier for creating change in places like academia. Is people don't want the change because it's a reminder of this thing they all want to forget about. And so, yeah, that's not a very practical answer to your question, but I think there's almost two things that need to change. And one is probably practical things, like, can we make classes more accessible again? We did it before. We can learn lessons from this time where we were all doing it very haphazardly and not in an ideal way. And we now have technology in our schools actually standing around. Like, there's a hybrid computer setup at my department that never gets used. But there's 3 of them we can book anytime we think. So there's some practical things that need to happen, but I think fundamentally there's also a huge mental thing that would need to shift for people to participate in these practices that are necessary. And I don't know, I would love to hear if anybody has ideas about what it would take to shift the denialist perspective or mindset that is very pervasive now around long COVID.
Does anybody want to jump in? Oh, Doris wants. My dog is barking. I think she wants to join in. Erik, do you want to say something?
Yeah, hi, thank you. Yeah, I have a question for everyone, I guess. So my experience in academia is that it's quite territorial as well. So people are very specialized and they don't like it when other people who are not specialized in that subject say something about that subject. So I was wondering how that might play a role maybe in the reluctance of some social scientists to say more about COVID than they do right now because they might feel like they're stepping on the territory of their colleagues at the medical hospital or university hospitals and stuff like that.
Yeah, that's a really interesting point. And I think during COVID, we did see a lot of this happening where people started to become COVID experts who had no expertise that was relevant and were providing advice. At least this was happening a lot in North America. Um, sort of epidemiologists offering advice about COVID, but they did a completely different kind of epidemiology and did not have relevant expertise. So I think we saw a very negative form of that happening where these are the reasons why maybe academics are careful not to step outside of their box. But as Judith so beautifully said, like we really need critical research, and who can do critical research? I mean, not to say that medical scientists can't do critical research, but these kinds of social justice questions that are so important are not questions that can be really dealt with through the medical sciences or the hard sciences. So we have a shared responsibility. But I also think researchers follow money, and long COVID, because it has fallen off of the public, well, it never really got the public recognition it should have in comparison to normal COVID. Um, it, there's less money, there's less incentive to pursue this, which is terrible. But yeah, this is a project I'm doing off the side of my desk. I don't have a grant for this. The primary investigator does. So yeah, I guess I've gone a bit off of your question, but academia is challenging because of egos, reputations, real risks to stepping outside of your area of expertise and getting it wrong, but also funding and time restraints and the pressures to follow the priority areas that funders and universities identify as worth following, which is a huge structural issue.
Yeah, thanks, Alice. I agree with everything you say, and I also think that it's not fashionable, unfortunately, because sometimes there are these topics that are fashionable, and then all of a sudden there's a lot of research about these. And I'm a political philosopher, and I find that a lot of my colleagues write very beautiful and interesting work about all kinds of forms of oppression and solidarity and all of that. And there are two, long COVID and other post-viral illnesses are really invisible. And I think it also has to do with the fact that this group can't really organize in the way that other social justice movements can, because of the nature of the condition. So it's difficult to speak for yourself. It's difficult to organize. It's difficult to attend demonstrations or team up with other activists, maybe in other areas. So I think that others, the people who are not ill, should step up. But then, of course, that's not something that's easy to arrange. So I think that, in academia, a lot of it has to do with a lack of interest in combination with a lack of knowledge as well, in addition to the points that you make about funding and power and the way in which the institution is organized. And I think that this also provides a natural bridge to Judith's other point about living in a fascist society and living under unfavorable conditions more generally, because of course academia is also part of a larger political structure in which there are in which folks with long COVID and similar conditions or the vulnerable more generally perhaps are disregarded and treated unfairly. So I don't know if anybody else wants to jump in. I saw 2 messages in the chat, one by Marvin Vos, who wrote, "Well said, thank you, Judith." And the second message is by Annelies, who explains a medical problem, in the sense that she asked her doctor for medication in case of COVID or flu, because society doesn't protect us. But then the doctor won't give her these meds because she has been vaccinated and also had COVID. And this is, of course, deeply problematic, because those who have long COVID or ME, or who had it in the past, have a much higher risk of getting long COVID again when you get ill. So the healthcare system is clearly not working in this regard, which is also, a problem of solidarity, I think, and a lack of knowledge. And in the Netherlands specifically, there's the problem that the knowledge that is available does not is not collected and sent to the GPs. So they sort of still pretend that knowledge does not exist, except, of course, there are doctors who do their own homework, but there's no general, how should I say this? There are no general guidelines about it, which is a deep problem, I think.
And I think that came through very clearly in this Canadian study as well, is the doctors didn't know. I mean, some of them really didn't, many of them didn't seem to care, which was actually awful. Like, there's quotes from people saying they brought research articles to their doctor and the doctor said, "I'm not going to read that. I frankly just don't care." And that is like, I was shocked by the level of gaslighting and denial from professionals whose job it is to help. And I'm really sorry to hear, Annalise, that you're experiencing a similar kind of, lack of support and even, denial from medical professionals whose job's supposed to be to support us when we need help. But I think the point about this larger social system, also the sort of, I mean, fascist was one word, but I also kept thinking in doing this research and reflecting on today and what Judith was saying about like capitalist and neoliberal as well, because so many of the people in our study ended up getting forced into a program called WorkSafe BC, which is all about getting people back to the workforce. And the recommendations there were, I feel like many of you, the people here, have experiences with long COVID personally or otherwise. It's the feeling I'm getting from the conversation so far. But so anybody here will know, like, this is the worst advice you could ever be. People were being asked to push the limit of their graded exercise every week on a very intense, accelerated plan of working back up your capacity. And not surprisingly, people's symptoms were deteriorating rapidly, but they were told they just needed to push through the program, just push through, because we need you to come be part of the labor force again. Our economy needs you. And so that's also a fundamental tension too in how we see illness and disability as a society, as something that should be addressed as quickly as possible so that people can start working again, rather than, interrogating the injustices and the inequities that Judith so aptly pointed out, and thinking about prevention and thinking about these measures that we've been talking about today, like remote learning. It's such a massively different mindset than the way society, at least in Canada, and I think in the Netherlands, tends to think about what health is even for. and how we should go about dealing with illness.
Yeah, I agree. And your point about forcing people to exercise is something that happened here as well, especially with the first wave of people who got ill from long COVID, and it actually made them a lot worse. So I think that it's just a really great injustice because you can make people permanently much worse. So it's just really, really awful that this is still happening. And also a complete disregard of what the folks with ME and CFS and related illnesses. In the Netherlands, we had Q fever, so people developed chronic Q fever, and they have been gaslit and ignored by the medical world as well. And it's a very similar story actually to the long COVID. And this happened not so long ago, so it's really problematic that the government never took this into account, did not warn people, but again, told them to exercise and get back to work and all of that. And I don't know if you're aware of this, but in the Netherlands, the UWV, so the organization who takes care of the who determines if people who can't work anymore get money or not. They 75% of their judgments of the conditions of folks with long COVID does not rely on medical facts. So it's basically their own opinion about, and compare this with cancer or something. Oh, it's my opinion that you don't have cancer, or that you can do this, or that you don't have this symptom or this thing. And it's really a huge, and the same with the ME community. In the Netherlands, people have been made much, much, much worse than they were by medical professionals and institutions and the political structure. So it's really a great injustice, and I think there should be apologies from the government to these groups, because it has ruined lives basically, and they're doing it again. I think it's getting a little bit better now, but yeah. So. It's already 9:15, so I am wondering if anybody has any questions or comments or things that they want to share in our conversation.
Yeah, I'd like to ask a question because I want to know, what can we do about it? About this all? How can we change it? Is there a way to change it? As a patient, it's very difficult. And you're not alone, but factually you are alone.
Yeah, I think that there are many things that are happening right now on a small scale. So I think that because so many people got ill with long COVID, a lot more than with post-viral illnesses before, you can see the situation shift a little bit, because doctors also get ill, politicians also get ill, academics get ill. And I think there are many more spaces for dialogue, like these conversations, but also other academic gatherings that try to change something in the way we reflect about these things. So in addition to the medical research, I think there's more attention for this from the humanities. I also think that there are a lot more books and artworks about these conditions, and that they also influence the public debate. I see a bit of critical journalism. It's still nowhere near where it should be, but I do feel that at least some people get the message. And I know in the Netherlands that I'm part of or organizing a larger demonstration with a group called Niet Hersteld. Guus Liebrands was also going to participate today, but unfortunately could not make it. So if you want information about this and join the working group for this demonstration or want more information about it, please email me. So I think it's always the same with social justice. Find out what you're good at and try to do a bit of that. And then if we all do that, hopefully this will move into the right direction. But yeah, that's just my 2 cents. I see that Erik has raised his hand. Erik, do you want to also jump in on this question?
No, not particularly this question, but maybe somewhat related to what we talked about earlier.
But maybe then Alice wants to also say something about in response to Annelies, and then we go to you, Erik. Thanks.
Yeah, I really liked Eva, your point of, find out what you're good at and do that. And yeah, I guess for me, that is partially research, but it's also very much knowledge mobilization, or yeah, getting the research out there, because this also is a part of research that you're not often incentivized to do or paid to do. But I feel really lucky. This team of people, at least I'm working with, are all very good at media, social media. So that's the part, I guess, that I would like to focus on. But I also really appreciated what Judith said about, we as researchers, I think, can learn a lot from actually hearing what is useful to you rather than what we think is useful. So, I mean, I can't guarantee I'll study everything you say, but if there are things that you think a social scientist or humanities scholar can help raise awareness about or provide light on, shed light on, like, I would love to hear them either via the chat, saying it now, or you can always email me. My name is very unique, and if you look me on the internet, and anybody called Alice Fleerkers is actually me, so feel free to reach out by any of those email accounts.
Okay, thank you. Well, I try to educate my own doctor, and he is open to it, but yeah, mostly there is not a lot of time to study or to read things, and that's also a problem. And I heard from an organization, Say Support, here in the Netherlands, that 70% of the doctors here, specialists, do not know what chronic fatigue syndrome is. Long COVID, yeah, they know a little bit of, but comparing it to other diseases, they don't know anything. And that's a great problem. 85% of the people in the Netherlands do not know what chronic fatigue syndrome is and what the problem for the patients and their loved ones is. So that's a huge problem.
Yeah. Yeah, a huge public awareness problem, but as you say, also medical doctors, people practicing. Like, we really need to get even some basic information across to them would make a difference.
Yeah, absolutely.
Sorry. Yeah, Eric?
So thank you.
Erik, do you want to jump in?
Yes, thanks. Yeah, so at the moment I'm studying psychology, and so I was thinking about, like, we talked about sometimes a topic in academia is trendy and it gets a lot of funding and a lot of stuff is written about it. So I was thinking about, how do you get attention for long COVID in academia? How do you make it trendy? And I was reminded of something that was taught to me at one of my lectures, that I think maybe 10 or 15 years ago, a prominent psychiatrist in the UK tried to get large-scale funding for large-scale research into depression, and he couldn't get it done, basically, until he met up with a very prominent economist who could, like, put an economic figure on the damage that depression is causing in society. And I was wondering if you know anything about whether people from economics are also looking, like, into the damage that long COVID is doing, and whether that's like a way into framing it in a way that the powers that be understand, like, this is a problem because it's costing us X amount of money, when people leave the workforce because of long COVID.
Yeah.
There was an op-ed about this in the NRC newspaper a while back, precisely about this topic. I will look it up if you can give maybe you can speak, Alice, and I will put it in the chat. I will look it up.
Yeah. Oh, I would love to see the op-ed too. Like, I think this is a great point, but also sort of like a terrible point because that's what it takes, right? To get people to care is show, oh yeah, our economy is suffering. But I do think, I mean, I don't know what's happening in economics research, and I think that's a great idea for me to look at in terms of communicating this research and framing it in a way that's impactful. But it's clear even from the data we have, which is just interview data with people about their experiences, that huge amounts of resources are being wasted in the medical system because of this. Like the number of people who are getting sent to specialists for things that are completely inappropriate, because if the doctor just had a basic level of knowledge about long COVID, like Annalise is saying, they would never be telling them to go see X specialist who is going to check for, I don't know, early heart attack issues or something. You know, there's so many of these people who are getting referred away. That was the primary role that medical professionals were playing, was just, I don't know what this is, so I'll send you for more and more tests. And we're spending tons of money on the WorkSafe programs that's actually hurting people, you know. So even just looking at this small subset of 30 interviews with people experiencing it, not even people working in the medical system, we see huge amounts of waste, economic waste happening there, and waste of people's time and expertise. So I can only imagine if you also then take into account all the people who cannot work or who can work much less. Even things you wouldn't think of, like tourism's probably negatively impacted. You know, you could get some very juicy numbers because
I also think like the broad scale cognitive impact of multiple infections leads to mistakes that are economically costly. Like it's across the board.
yeah.
Even if you're still in the workforce fully, it still can impact your functioning, and that, yeah.
Yeah, I think it feels like very much a wicked problem, like in that it's so multi-pronged. You know, there's the economics in terms of impact, there's the information and education component, which has largely been what we've been focused on. There's the healthcare component, there's the psychology and the denial that we've talked about. There's this social, cultural element of how we deal with illness, how we deal with vulnerability, and how we take care of people who are vulnerable. It is so multi-pronged. And so that means that it can't just be us being individuals as islands working on our one little piece. We really need more things like that where people can bring the pieces together, because you can't deal with a problem this complex through just one lens or one form of, not attack, but approach.
Yeah, I agree. We need a multidisciplinary approach. And I also think that by highlighting the fact that we need a new attitude towards those who are vulnerable or sick or whatever, you show that there's a problem with the economic approach, which is that it basically favors some forms of life over others. So I think that it's a bit tricky to rely on neoliberal argumentation if you want to also argue that we need to take better care of each other and challenge the system from there. So maybe there's a space for this type of argument in certain discussions, but I'd be a bit careful of using it when arguing for political recognition and these things, because otherwise you sort of stay inside the system that you want to challenge or problematize. So, all right, thanks everybody. We have room for maybe one more question or comment. So if somebody has a pressing point that they want to share with us? And if not, you can also always respond to the video when it's online. Well, if nobody has anything else to say, I want to thank Alice very much for her presentation and research and for speaking with us today. And Alice, also thanks a lot to your colleagues from us. Please tell them that we're happy with people doing this research. I want to thank all of you here today, and of course Judith from Feminists Against Ableism and the other feminists of the same organization as well, because they've been helpful through email. And yeah, thanks to everybody who has been watching this later and online. I hope that you are doing okay, and I hope to be able to continue this series next academic year. But yeah, we will send you an email about that. Thanks a lot, everybody, and see you soon. Bye.
It was really nice to meet you all. Bye.
Bye.